So welcome to our 2022 Utah Broker Education Day.
All right, and you are listening to David and Brandon. Let's dive in.
So on the agenda is going to be 2021 OEP. We're going to start there. We're going to go through the 2021 extended OEP and then any changes for 2022, and then we're going to dive into all of the carriers. So results from last year. So OEP saw some growth last year, and we were kind of saved by an August 15th extension of OEP. But this is specifically for the true open enrollment period from November 1st to December 15th of 2020. Okay, so let's go over 2021 OEP. This is Health First number right here for OEP growth. We grew about 17% as an agency. And so if you grew more than 17%, pat yourself on the back. If you did not, and you want to go over your numbers and make sure you grow like that next year, get with us individually and we'll go over some things with you. So it's also a little bit lower than in previous years. And we believe that's just due to COVID. And there was a lot of changes in the market as well. On the right side here, we're going to talk about the 2021 market share. That is a typo. It is 2021 market share, and this is statewide data. So we like to go over each carrier and what percentage of the market they own. And so Select Health, you can see 82% of the market. Molina had 8%. The University of Utah, 5%. Regents had 3%, and Cigna had 2%. So this is a list of the top 10 plans that were sold in 2021 during OEP statewide. And so you can see here the benchmark silver 6,500, the no deductible for office visits. That was a big hit. There was 23% of the market was on that plan. You can see the next most popular plan is the 6,900 HSA qualified plan. So that was really interesting to us. We didn't think that was that high. That's 17% of the market. If you look down number 6, Molina Core Care Bronze 4, that was 4%. The University of Utah was number 10 with their Bronze HSA plan. So Utah does like their HSAs. So this is now 2021 extended OEP. So anything after December 15th going all the way to August 15th. Actually, these are our year-to-date numbers through July because we haven't been able to get everything. So as you can see, we look at this. We look at the attrition rate there in January and February from those that didn't effectuate or those that didn't make their second month's premium or anything like that.
Proof of income, things like that.
Really anything, and this number is actually a little bit better than in years prior. So that was really good to see. But what was even better to see was that number go way up through July. So we actually gained 6.5% February through July, through the end of July. So that was really nice to see. Changes. So changes here for 2022. Benefit changes, and this happens every year. Maximum out of pockets on ACA plans, they move and they go up every year. So last year they were $8,550 for a single person, $17,100 for a family, and they've gone up a couple $100 on each side. This HSA contribution limits also increase, and they do that every year. So that went up a little bit as well, $50 single and $100 family. So that table for both of these tables is actually on your placemat. So if you didn't get a placemat, we will get one to you. We'll mail it to you. You can come by the office. You can pick it up, but you definitely are going to want one of those.
All right. So quickly, we are going to talk about the American Rescue Plan. So that is something that kicked in for 2021 and is going to stick around for 2022 as well. So on the screen, you see a text conversation between myself and a broker that was beta testing our plan year 2022 quoting tool. More or less, they had this couple up in Davis County that was still getting a tax credit with an income of 150,000, and they thought that it was wrong. They upped the income to 235,000, and they still got a tax credit, and they thought that it was wrong. So I reverse engineered the math, plugged this 57 and 60-year-old into the tool up in Davis County, and found out that the benchmark plan in their county is going to cost them $1,695 per month. So the way the American Rescue Plan works is this plan at $1,695 per month is going to cost more than 8.5% of their income until they make $239,294 per year. So really, the biggest takeaway here is the 400% of the federal poverty line income cliff does not exist anymore. I don't know what $239,000 for a family two is percent of FPL, but it's somewhere close to 2,000% of the federal poverty line. So if you're using the quoting tool and they get a subsidy, trust me, it is accurate, it's correct. If you are not using our quoting tool, just be aware that that 400% cliff is gone, and that you may have clients that are going to qualify at ridiculously higher incomes. So if they're on short-term medical and they're high income, this might be a good year to move back to the ACA. And if you're worried that somebody's not going to qualify based on their income, it might be worth it just to double check and see if they qualify for a subsidy. So real quick, we also want to talk about the repayment limits for people that exceed 400% of the federal poverty line. So on your placemat, you're either going to see the terms in the repayment limits table as no limit, or it might say 8.5% of MAGI, modified adjusted gross income. But we're going to talk about how that works. So this was another case study that we did, and you can read through this another time if you'd like to. But this is the section that we want to focus on here, is just the last half. So this was a case study we did. It was a young household of two. They were about 35 to 40 years old, and we estimated their income at $69K, which is 401% of the federal poverty line. Under the American Rescue Plan Act, the subsidy that they get at that income estimate is about $3,180 annually. So they're at 401%. They do qualify for a subsidy. And then at the end of the year, if they ended up filing an income of $100,000 on their taxes, they are going to end up only qualifying for $552 worth of subsidy. So instead of paying the entire amount back as they would in previous years for being over 400% of the federal poverty line, they're only going to owe back the difference just like everybody else, but there's no cap, there's no limit. It's just a straight up repayment. So in this scenario where they ended up filing $100,000 income, they're only going to owe back $2,680, which is just about the repayment cap for married couples that file an income between 300 and 400% of the federal poverty line last year anyways. So just they won't owe back the full amount. They'll just owe back the difference between their estimate and their actual filed qualified for subsidy. But there's just no caps on that payback. So that brings us to Agent Intel. So this is the long-awaited broker portal that Health First has built for its brokers. So the website here is agent-intel.com. You'll just log in using Google, just like you do for the quoting tool. And this is what it looks like. So right off the bat, you'll see that we do have a banner notification system. For instance, here it talks about how open enrollment was extended until January 15th and how plans chosen after December 15th and before December 31st without a Medicaid denial entered are going to begin on February 1st. So you'll be able to receive quick and accurate need to know information without us blowing up your cell phone or your email. The broker portal consists of the following apps. We have quoting, coverage search, Bob, reports, FAQ, resources and fact sheets, library and training, contracting, and important contacts. So we are in the process of polishing out a couple of these before the official release coming next week. But this is the value that you're going to get from having this broker portal. So first off, important contacts. This is going to contain this all of the phone numbers and relevant email addresses to various carriers.
This is going to
So here you'll just be able to find all of the information related to contacting the carriers across the board. You can see some of these are a little bit light, but we will add more and more information on how to contact the carriers. Next is going to be contracting. So this is a section that will show the various contracts that we show that you have, and then it'll have a section where carriers are grayed out or states are grayed out, and you'll be able to request contracts for carriers that we don't have you appointed with or states that you're not appointed in. And library and training here has the knowledge base and training videos. So this is mostly going to be how-to guides or educational guides, either if you as a broker want to learn more or if you're bringing on support staff that you need them to learn and get caught up to speed. So the knowledge base right now does contain various walkthroughs and documents. Here's a PDF walkthrough on how to do National General for their short-term medical or the accident medical enhancer policies. Here's an article that goes into an in-depth analysis of how subsidies are calculated. And then right now, this is the only section on our website that actually houses videos. So there's a lot of other stuff in here, but mostly you will have these training videos such as how to add clients on Health Sherpa, how to do quoting households in our quote tool with enrollees that are not claimed as dependents, and then other things like how to do a National General application for short-term medical or accident medical enhancer. So we are just going to be kicking out content left and right to go into that section just to either help you learn and grow as a broker or train support staff. Next, that brings us to resources and fact sheets, and this is going to contain a lot of information, mostly things that are going to go from the carrier to you for your information, or from the carrier to you to go to your client for their information. So you can see here, we do have all of the AORs are going to be in here along with instructions on how to submit them. If there are any sort of marketing materials from a carrier, you'll be able to have access to those. Some of our marketing materials will be in here just for reference, but you can order those through our website, hfrocks.com/products. And then, but there will be other things like this Select Health Think of Me flyer is a co-branded flyer that you can put your information on and send out to clients. Summary of benefits will be available here as well. And then fact sheets. So fact sheets, we're actually you can either click on this and you can access all of them. You can also go directly to the carrier if you want to see their specific fact sheets, which is my recommendation. So for instance, if you drill down into Select Health here, you can see all of their specific AOR, SBCs, fact sheets, and marketing. So in fact sheets here, if you want to learn, their wellness rewards program in Spanish, if you want to see, scroll down here a little bit so you can see, here's their list for 2022 of drugs, devices, and tests where the deductible is waived. Here is their little flyer about Intermountain Connect Care, and you'll just be able to go and look through these, or you'll be able to search the website and it'll pull this up as well. But that'll help organize documentation either for your learning or materials that go from you to your clients on the carrier's behalf. Next up, we have the FAQ, and this is going to be a work in progress, but the goal here is to essentially have this be Google for health insurance. So hopefully many of you at some point in time or another have reached out to us via the Green Line, which is our broker support line, either by text, call, or email. As people call into the Green Line and we find answers or we find common questions, all of those are going to get added here into this FAQ. So you'll have the benefit for you and support staff to be able to find quick answers to questions that other brokers have already asked. And so right now there's a fairly decent set of answers in here, but this list is going to just continue to grow over time. So this will be an excellent resource to find quick answers to quick questions. And then if the information's not contained in there, we also have this questions, comments, and feedback feature as well. So this would be something that you could use if there's a fact sheet that you rely on from the carrier for information, but you don't see it in the system. Just let us know, and we'll get a copy and we'll put it in there. If you couldn't find an answer or you came across something that was outdated, just make a note here, send it to us, and we'll get it updated as quick as we possibly can. Next, we have reports. So this is something that we will have multiple forms of access for brokers and then for support staff, just to show or not show certain data sets. But in the reports section, this would be just for the broker and would not be available to support staff, but they would be able to see policies, commissions, and then lives. So this will track over a 13-month period. So as the broker, you will be able to drill down and view your policies and see the various commission amounts and rates per your policies. You'll also be able to drill down into commissions and see commissions specific by carrier as well. Next up, we have Bob, which is your book of business report. And then, so this is going to be a way, for instance, here, I'm going to go ahead and just search everything. And as you are contracted with us and carriers make their payments, more or less, we get information from the carriers, we get information from commissions, and then with the Health Sherpa aspect being added, if you join our agency on Health Sherpa, we bring all three of those data sets together into this one spot. And this is what it's going to look like. So it'll tell me the name of my client, how to get a hold of them, email, phone. It'll tell me if their policy status is active or not, show me a paid through date, what plan they're on. If that plan has a cost sharing reduction, it'll tell me which one. We're looking to get effective date data, enrollees. It'll tell me his premium, the full premium, the subsidy, and then information about commissions, which once again, in a broker support account, it won't show the information on commissions, but you will see everything else. And so this will just be a way to keep an eye, day by day, to bring up your clients and to see their information. So you'll be able to filter by metal level and by carrier. You can also search by county or specific subscriber. So if they call in and they have a question, you can pull them up and look at it here. And then, for instance, let's say because Molina is, spoilers, discontinuing all of their bronze plans for next year, maybe you want to figure out very quickly which of your clients are on Molina bronze plans. And then here it'll search and it'll tell you. So that is the book of business. We'll have just lots of good accurate information, and then let's talk a little bit real quick about um, how we get and what we actually do with that data.
So, Bob is something that we've been working on for a very long time. Um, all of that data comes directly from carriers, right? So there are some carriers that we have a general agency portal for where we're able to go in and download every single day. Select Health doesn't have a general agency portal. So essentially, what we have to do is we have to get a feed directly from their data team every single day. We check that from the previous day to make sure there's no changes. Ultimately, in the future, this will have it will let you know if there's anything that's changed from day to day. Right now, you probably see some emails from me that I sift through daily to make sure are correct. We find bugs here and there, and we're just kind of going off of that carrier data. So Bob will be a place where you're going to be able to access essentially your broker portal in with each carrier all in one place. So it's going to be a very valuable tool.
As well as the information that's in Sherpa. So if you create a Sherpa account and you join our agency, some of the things that we've hated in the past because healthcare.gov doesn't communicate is when a message goes out, somebody loses their subsidy, or something changes and nobody tells you as the broker until it's too late, and you get that call from your client that says, hey, uh, my insurance is gone and I have no idea why, or my price went up, my subsidy went away and they jacked $800 out of my account and I don't know why. Being integrated with Health Sherpa and then being integrated with healthcare.gov, we're going to be able to help track those sort of events and be able to warn you before they happen. And so that's going to tie into Bob as well. So we do highly suggest that a Health Sherpa account gets set up. You bring your clients in there and you join our agency, and that'll just help us help you help your clients. Next, that brings us to the coverage search. So some of you may have betaed the one that was in the quoting tool that had Molina and Select Health last year. This is that, but much, much better. So this is a direct link feed. Part of it goes through healthcare.gov and through the CMS databases, and then the other half goes through the carrier databases and more or less searches both of them and brings them into one spot. So once you get set up here on Agent Intel, this will default to your zip code, but this is what you'll be able to do. So you'll be able to search for a provider. It is going to return the 10 closest matching providers to that zip code. And here it's going to tell me who it is, what their practice is, and then which carriers and networks they're accepted in. So as soon as the 2022 data goes live on healthcare.gov, we'll be able to get that information into here. But you'll be able to find a provider, verify who they're in network with, and then here you can actually save this to your coverage cart, which is why we've got that little shopping cart up here on the ribbon. And I'm going to show you why that is. So here, when your client gives you their list of providers and medications, whatever it may be, you'll just be able to go look them up and add them to the coverage cart. Let's go look up a medication. And then here is where we really get into the what comes from healthcare.gov and what comes from the carriers. So here you'll just want to make sure that you're looking at the correct dosage and type of the medication. For instance, this 1 milligram oral solution, nobody covers. But here we go. Lisinopril in a 40 milligram oral tablet. These check marks indicate that it is covered. It does show up in a formulary on the healthcare.gov data set. The tier information actually comes from the carrier. So, for instance, Cigna here shows no data. Their website must have crashed and is not reporting to healthcare.gov right now. Molina is reporting to healthcare.gov. It does show up in their formulary, but there's no tier information available because Molina has not gotten us that data set yet. But eventually, because we showed this to Molina and Cigna, and they both agreed that it would be stupid for them to not be on here, they are going to get us the files necessary or the access necessary to make sure that that information comes up accurately. But once again, you'll be able to save those medications to the coverage cart. And here, when you go to the coverage cart, you'll be able to save this as a PDF. And then you can email that over to your client. You can save it for your records. But here, it'll just show the provider where they're covered, and then medications and where they're covered. So you'll very quickly be able to send that information to your client. All right. So last but not least, that also brings us to quoting. So we are in the process right now of rolling out the Quote Meal tool for plan year 2022, and we'll be able to hook up the link to your tool here inside of Agent Intel. So you'll just be able to click on it and it'll just launch you directly over to the quote tool. And then you'll be able to pick up and start running quotes for plan year 2022. All right, and that is Agent Intel. We hope that you're excited. We will be sending out an email more than likely on Monday, letting people know that they need to go to agent-intel.com, go ahead and register for an account with your Google login. It will tell you that you don't have permissions yet. We just need to go in and grant the permissions from our end, but you'll just go to the website, register for an account. We'll make sure that everything is good on our end, and then we'll notify you once your access has been granted.
So this is enrollut.org. This is a website that we actually market to, and this is a consumer-facing link. This is to promote and to market all of our brokers. And so you're more than likely on here. There are a few requirements to be on here. One is that you only have one location and that you have at least 30 policies. And that's just to ensure your knowledge and expertise in the individual market. So all they would need to do is actually go to enrollut.org, type in their zip code, and get help. It will return the nearest brokers to their zip code. We can put your logo on here. We can update your name, email, address. We can put your website on here, whatever you want to do. So maybe jump on to enrollut.org, see if you're showing up. If you're not, make sure you meet those two requirements, and then give us a call. You can email or text the green line and let us know, hey, I want to show up on EnrollUT. Here's my information, and I will email you my logo, and I'd like to have my website up there, whatever you guys want on there. It's really, it's going to be a great tool. It worked very well last year, and we're going to continue to do that throughout the years. So we're really excited about this.
And then I can't remember if we had spoken about it, but we front all of the advertising costs for enrollut.com. So we do roll out billboards, we do Google ads, we do Facebook ads, and we advertise a lot of this, just trying to drive consumers to the website so that they can get a hold of their closest local broker. There is also the option for them to go ahead and enroll now, and it just takes them through Health Sherpa. If they do manage to go through Health Sherpa and pick a plan, then we simply, based on their address, we find the closest geographical broker, and then we'll assign them to you, and we'll touch base with you and say, hey, this person signed up through EnrollUT. They are now your client. Please reach out to them and let them know that if they need anything at all, they can reach you directly.
Okay, so looking ahead to the carriers, we're going to quickly go over each individual carrier, their value adds, their popular plans, all kinds of stuff, their premiums. We're going to go over all of the carriers individually, and really, we do this every year so that you don't have to go to Select Health's training, the University of Utah's training, Bright Health's. Like, we just need to, you just want to come to our training, and you'll have a couple hours of just
The important
the
stuff.
important stuff. Exactly. So let's go over premiums. We'll start with Select Health. You can see that their bronze plans went up. Um, their largest change was 4.5%. And so I think carriers are starting to catch on to the fact that they can actually bring up the price of bronze plans and not really affect the consumer much at all if they're subsidized. They're actually just going to get more money from the government. So it's a great way for them to just make extra money and not take any skin off the consumer. On silver plans, obviously they need to be more competitive. They've caught on to the whole second cheapest silver plan, and that's what determines the subsidy in that county. So you'll see them kind of fighting for this spot. You can look through this. And you can see that some of the carriers didn't really do what we thought they were going to do, or what they should have done, or So the University of Utah, they did go up in their bronze plans, which is good. Their gold copay went down 17 or 18%, and that was a good move on their part. Problem is, it's still about 20% away from the next most expensive plan. So Cigna went up across the board. Not sure what happened there. Molina, as you can see, they removed their bronze plans. So there won't be any bronze plans. We're going to see a lot of that shift over to some other carriers, and we'll go into that here in a little bit. Regents, I'm not sure what they were doing, but they brought their bronze plans down, which doesn't make any sense. And they did go down a little bit on some of their silvers. So moving on, we'll start with Select Health. We're going to go over networks, counties, and plans on this slide. So there is a new signature network, and that was important. It is important. It includes all IHC hospitals on the Wasatch Front and 5,000 providers. They're about 3%, 3% lower premium than value. They have expanded their value network quite a bit, adding about 2,000 providers. So they are larger than Select Med was last year, that network. It went from 9,000 to 11,000. Same thing with the Med network. They went up about 2,000 providers as well, from 10,000 to over 12,000. So their networks are getting a little more robust. You saw a couple years ago, there were some issues, especially in some rural counties, Summit County, Wasatch County, where value moved in, but they didn't really have the network there. It didn't have enough providers, and that was really difficult. It really affected the subsidies. Those that were on Med had to go down to value, but then they lost their doctors. So adding those providers, it's a big deal. The new signature network is only available on the Wasatch Front, like I said, in Weber, Davis, Salt Lake, and Utah counties only. They discontinued some plans, their bronze 5,900 HSA and their silver 3,000. And of note, big news, they brought in two new plans, and they're very cool plans. So they have the Benchmark Expanded Bronze Zero Copay and the Benchmark Silver Zero Copay. Note that the name is a little confusing, but really what it's saying is that it has a zero deductible. So you've got a zero deductible bronze plan with some copays, all pre-deductible benefit because there is no deductible. Same thing on the silver, and that's with no cost sharing. So those are both pretty cool plans. The Signature Network, oddly enough, is only available on 8 of the 14 plans that are offered by Select Health. So not on their HSA, not on their Silver 3300 Direct, and there's about 4 others. So just keep in mind when you're looking at your quoting tool, if it shows up in the quoting tool, it's available. If it doesn't show up, it's not available. So benchmark plans are all 100% EHB, which is very important because those 100% EHB plans can possibly see a zero premium in certain counties based on their income and family size. So value adds this year, there's not much, nothing really different. Virtual care, zero copay, most plans excludes their HSA and catastrophic plans. Their wellness reimbursement still the same, $240 per person, $580 for the family. One new thing was that if you they have a 3-state footprint. So Select Health is in Idaho, Nevada, and Utah. And so if you go outside of their coverage area for urgent or emergent care, if you use the United Healthcare Options PPO, you'll actually save quite a bit of money. Just they'll have better contracted rates. So you can still use it anywhere, urgent and emergent care outside of their footprint. But if you do know you're going to use it and you have the time to look up United Healthcare Options PPO network, maybe go there, save some money. The benchmark plans, and this is the same every year, but those provide coverage for essential health benefits only. So those are 100% EHB plans. Value and Med Network can go to the Huntsman Cancer Center with a cancer diagnosis, but very importantly, the Signature Network cannot. So Signature, no. Value and Med, yes, can go to Huntsman Cancer Center with a cancer diagnosis. These are the popular plans that we determined we're probably going to see this year. We're usually pretty accurate on these every year. You're going to really be selling a lot of that bronze zero copay, bronze zero deductible, with some copays. The bronze 6900, we may not have put that in there in years past, but like we said, it's a very popular plan. 17% of the population of Utah is on that, on the individual market. The benchmark silver 6500 office visit copay, that one will be important because it can have a zero premium in certain counties with your income under 150% of the federal poverty line. And then obviously that benchmark silver zero deductible with copays plan will be very popular as well. The University of Utah health plans, not a ton of changes here. Not very competitive this year, so I'm not going to really spend a ton of time on that. Their network did expand 8,100 to 9,800 on the preferred network. On the premier network, went up about 1,000 providers as well. There's no changes in the counties in which they're offering our plans. They did add a few plans. Their Wasatch Bronze, Silver, and Gold. That's only on the preferred network. We're not really sure why they say Wasatch in there because they're available outside of the Wasatch front, just as long as they're in the preferred network. All plans are 100% EHB, which is really nice. So all of their bronze plans, not all of them, but a lot of their bronze plans will be eligible for zero premium. Value adds, $0 virtual care on most plans through MD Live, not on their HSA. They've got a $50 gift card for flu shot members, they have a $50 gift card for flu shot per member on the plan. $50 gift card for preventative visits for adults over 18, and a $25 gift card for well checks for children aged 3 to 17. So they have a pretty good wellness program. Of note, they are returning $2.2 million to 2020 members. We keep telling them to just lower their prices and then not give any money back like every other carrier, but that just seems... Anyway. CPAPs are covered, and that is new for this year. So anyone who needs a CPAP, the University of Utah plans cover that, which is really, really a nice benefit. Maybe they want to save $300 on their premium and just buy their own CPAP, but that's up to them. Popular plans are going to be the Bronze HSA and the Bronze 3 copay for the University of Utah. Molina. So there are going to be no network changes, no county changes. We spoke a little bit earlier about them discontinuing all their bronze plans. That was a national strategy, essentially to move as many people over to those zero premium silver plans with these new subsidies from ARPA. They feel like there's going to be a significant shift there. And that works out very well if you are the first or second cheapest silver plan in the county in which you're offering. But in most cases, they are not. And so we feel like they're probably just going to lose a lot of their membership. They did add a Silver 7. They have some adult vision plans. So all non-adult vision plans are 100% EHB, thus being qualified for a zero premium, hopefully, if they're the first or second cheapest silver plan in that county. Their value adds $0 virtual care on all plans through Teladoc. Urgent care is the same copay as their primary care copay, which is really, really a cool benefit. I really like that. They have their Molina Care team on their broker support line, which is now being answered. You don't have to wait for 2 to 3 hours on hold. But that care team is designated specifically to help brokers and consumers manage those HIX escalations with the marketplace. So Molina will actually step in and contact the marketplace and help resolve those very quickly. They do have a $50 reward for a health risk and wellness exam aged 18 and older. So that's their wellness program. Of note, they have no tobacco rate up, which is nice. And the popular plans this year will be their Silver 7 and their Gold 1, because that Gold 1 is priced lower than most silver plans. It's pretty down there in price.
Yeah. So if you come across it in the quoting tool where you see a gold plan mixed in with your silver plans and it's the Molina Gold, don't worry, that is accurate. That is the price. It is ridiculously low premium.
So brings us to Cigna. There are no network changes, no county changes. There's not much appeal here, be brutally honest, with Cigna, except for they have some really cool plans. They discontinued their bronze plan and they're adding some new plans here. So they've got a new bronze 6800 diabetes care, a bronze HSA 7000. It was nice to see them adding an HSA. They've got a silver 4200 asthma COPD care and a silver 5000 plus acupuncture plan. I like their names. They're very specific. It's very easy to understand what these cover. So all non-acupuncture plans are 100% EHB as well. So value adds here. Well, let's talk about these plans a little bit more. All of their diabetes plans, or all of their plans in general, not just their diabetes or their asthma COPD, but all of their plans cover tier 3 insulins at a $25 copay. So that's a huge benefit. And it looks like carriers are kind of getting into these niche markets where they actually are funded a little bit by the government to help certain chronic populations. And so in this case, they're targeting diabetes, anyone with asthma. On their asthma COPD care plan, they have their inhalers. There's a certain list of inhalers, and we'll get all this out, and it'll be in Agent Intel. But it'll go over specifically the benefits of these types of plans. Of all of their plans have that $25 insulin copay, but the diabetes care plan, any of the diabetes care plan, they also include a lot of different equipment when it comes to diabetes. So those are great plans for diabetics. So if you have a family member that's on a plan with Select Health or Molina or anyone else, and they have diabetes, you might want to carve them out and put them on one of these plans. They're really great plans. So value adds for Cigna. They have a $0 copay for virtual care through MD Live on most of their plans. Cigna does want to co-op with brokers targeting these specific populations. So if that is appealing to you and you want to co-op market with Cigna, we'd love to chat with you. Just give us a call and we can go over a target market and your plan. They also purchased MD Live, which was kind of cool. So my guess is the $0 copay for virtual care is here to stay. They no longer have a referral requirement. They didn't have that last year either, but they really wanted to just highlight that and make sure people knew that there was no referral requirement. These are the popular plans, obviously very niche markets. Diabetes care plans, both that bronze 6800 and the silver 3500. The asthma COPD plans, silver 4200, and the acupuncture plan, which is the silver 5000. So this is a very important slide, and I know it's about regions, but really pay attention to this because you could really steer your client in a horrible direction if you don't understand how these Regence plans and networks work. Regence introduced, very similar to Select Health and their signature network, their new SaveWell network, which is a very narrow network. It has only the Steward Hospital system in network. Steward was actually bought out by Mountain Star or HCA a little bit ago, last week, and but the Steward Hospital will still be in network. The Steward Hospital system, as it sits right now, will still be in network with SaveWell. They have to honor that contract. Note that it only goes to the Steward Hospital system. That is it. They do have another network which was introduced a few years ago, and that's their individual and family network. That is just Mountain Star or HCA and the University of Utah. So no Steward Hospital system in the individual and family network, only Mountain Star and U of U. And with SaveWell, it's only Steward Hospital system, not Mountain Star and U of U. So you need to be very, very careful as to which network you're choosing, and do not include the Steward Hospital system in the individual and family network. The new SaveWell network will be available in Davis, Salt Lake, and select zip codes in Utah County. Yes, that is odd and super weird and frustrating because it affects subsidies throughout Utah County. So Utah County is essentially now split into two different sections, one northern part and a southern part. That will actually be in your quote tool. So based on their zip code, if they are north of Linden, then they are in the northern part of Utah County, and SaveWell is available in that county. If they're south of Linden, then the SaveWell network is not available in that county. So just keep that in mind when you're looking at your quoting tool. Plans, they discontinued their Silver Care On Demand 4,000 and Gold 12,000. They have a new Bronze 7,000, a Silver 6,500, and a Gold 2,500. None of their plans are 100% EHB, meaning that none of them will be, you won't see a zero premium on any of these plans. They're 99.7%. So you won't see a zero premium on any of these plans. Regence is actually 99.7% EHB on all of their plans. So not sure why. They don't like that zero premium. Value adds, no referrals, $0 virtual care through Doctor on Demand on most plans, not including their HSA. They do have an IAP or an individual assistance program, which is actually really cool. And that is for mental health. It gives you 4 visits per incident. And that is for every member in the on the plan. So 4 visits per incident.
And it's free visits, right?
Yeah.
It's 4 free visits for mental health. So if you're having, like, if you lost a family member and you need to talk to somebody, you have 4 of these visits you can use per that incident. And then if a week later some other tragedy occurs and you need to talk to a professional, you can go in and you also have 4 free visits to use for that incident, to just mental health reasons.
Yeah.
So it's really nice.
It is really, really nice. Value adds, no deductible for preventative drugs on their optimum value medication list, which will be in Agent Intel. They have insulin cost share caps for $28 for a 30-day supply. Their individual and family network has a 4-state footprint. So they are actually in Utah, Idaho, Oregon, and Washington. And so if you go outside of that 4-state footprint for urgent or emergent care, they have access to the Blue Card outside of that for care. They also have pharmacy in all 50 states. Yeah, that was just one of their value adds. So of note, everyone needs to complete their credentialing certification by 10/31. So this is a separate certification that is put out by Regence every year. If you do this, you actually get a raise in your commissions. So you get $1 per member per month raise in your commissions. Of note as well, if you hit over 75 members, they will give you $5 per member per month on their plan. So it's actually a total of $6 per member per month on commissions in a bump. So what we're doing is, because we don't feel like anyone will ever hit their 75 members by themselves on Regents plans, just based on their filings and their rates for this year and the counties that they're in. But surely Health First will. And so what we're going to do is, if you do decide to, you don't have to, but if you do decide to write a Regents plan, you can write it in Sherpa. At the very end, when it asks for your NPN, there will be a drop down. You can use yours, or you can use mine, Brandon Combs, and it'll have my NPN in there. And if everyone writes on that, then we will essentially split that that commission, that extra commission. So you'll get an extra $3. If you yourself hit 75 members, then you'll get the full $6. We'll definitely help you out there. So
just as a quick sidebar, you can, if you don't do through Sherpa, if you do have somebody that writes it direct through healthcare.gov, same thing. Brandon's information is on the screen. They can put in his name, his NPN as the broker. And we actually did this last year as well. I don't remember if we hit the bonus last year.
we did.
We did. So we did hit the bonus last year. And there were a couple of brokers that did squeeze out the extra $3 per policy last year. And then I think we had one group that was one person short of hitting the 75 policy bonus, because last year it was a policy bonus. This year it's a member bonus. So should be a little bit easier to get there this year. But that is a great way to write that policy under Brandon and squeeze out a little extra commission.
Yeah. Popular plans for Regents this year will be their Bronze Essential 8,000, 4 times copay, or their Silver 6,500. So I'm sure you've heard, or you're aware, that Bright Healthcare will be a new carrier in Utah this year in 2022. They're coming in with the Mountain Star or HCA hospital system with that merger with Steward, where they're trying to get those 5 other facilities that were with Steward in their network. They're not in there right now, so just note that they are working on that. We're not sure when that'll happen, but it should be a little bit easier now with this merger. But as of right now, it's the Mountain Star or HCA hospital system, and that'll be on your placemat as well. They will be in Box Elder, Cache, Weber, Davis, Salt Lake, and all of Utah County.
Not just the northern half.
Yeah. Their plans, they're all of their non-adult vision plans are 100% EHB. Really nice. See a lot of zero premiums there on the bronze sector, and then also in the silver as well in certain counties. They have really cool plans, and so really make sure you're taking a look at them this year. I think they're going to be a big hit. They're priced pretty competitively, and they're a non-IHC, network here on the Wasatch Front. So I think they will do very well. They have $0 virtual care through Doctor on Demand on most plans, not their HSAs. They have at least one free PCP visit on most plans. So there's some that have 2 PCP visits that are free, and some that are 3 PCP visits for free. Really cool. And then after that, it jumps into their copays. It's not like it's subject to deductible and then co-insurance. They have a lot of pre-deductible benefit, which is very nice. They have a free generic list on most plans, so a lot of their generics are free. They have a zero copay. They do have a $50 or less urgent care copay on most of their plans. And they have the best wellness rewards program. So they've got a $500 wellness reward program per member aged 18 and older. So the way that works as of right now is that like the first $250 is earned by setting up a member portal on Bright Health's website and taking a risk assessment, or evaluation. And after that, you'll get your first $250 on a Visa debit card that's sent out. And then also, based on that assessment, they will assign you different tasks throughout the year to earn the other $250. So if you have diabetes, and they might have specific exercises they want you to do or whatever. So they do not have an app, which is a little odd, but I'm sure that they'll be looking at getting one here in the future. But their popular plans will be a bronze zero deductible plan, which is going to be very nice. It will kind of help with the drop off of Molina bronze plans, which we saw in the earlier slide had about 6% of the state population on it. So I believe that Bright Healthcare will pick up a lot of these bronze zero. You'll see them as zero premiums with subsidies. It's going to be really nice. They also are going to have their silver 6700 plan. And so those will be their popular plans this year. National General, we'll talk quickly about National General, short-term accident medical enhancers. These are great for coupling with a bronze plan, especially these new bronze plans that are coming out with pre-deductible benefits. It's a great way to build an amazing plan for someone who's kind of in the middle of the road when it comes to a subsidy. So premiums on these short-term plans and AMEs went up a little bit, not much, not really of consequence. Their new 87, they have a new 8700 AME accident medical enhancer benefit level to match the ACA max out of pockets. So every year they do this, they have an accident medical enhancer, and the benefit level, you can buy a 3,000, a 5,000, a 10,000, and then also an 8700, and that is to match the max out of pocket on ACA plans. They'll go up again next year as well. They've also increased their lifetime limits to at least $1 million on all of their plans. So that was nice. Best One Dental. If you know us at all, we hate individual dental. We always have, and I would have said we always will. But we love Best One Dental. It's a great plan because there's no waiting periods. There's no deductible. They have a massive annual maximum. They have actually 3 different plans, an economy $1,500 annual maximum plan, a middle of the road $3,000 annual maximum, and then a $5,000 annual maximum, which is pretty much an unlimited benefit. These plans have no waiting periods, but what they do is they actually reduce their benefit that they pay out in the first year for the consumer. So instead of, so their first year, they will actually be 100% for preventative, 50% for basic services like fillings and whatnot, and then a 10% benefit for major stuff like crowns, root canals. That is to prevent people from just jumping on these plans just to get their crowns done and their root canals. The next year, so year 2 and on, they have a great benefit. It's 100% preventative again, and then 80% for basic services like fillings, and then 60% benefit for major services. So they have a great plan. They have great customer service. They have a great network. It's actually the Dentamax network coupled with Connection Dental. They have a direct broker link. So once you get contracted, they'll send you out a way for you to log into their broker portal and register for your own links. You'll be able to take those links and text them, email them, put them on your website, whatever you want to do, and consumers can just enroll, and it's hard coded to your writing number. So it's actually great. We have it on the quoting tool, so you'll be able to couple that with your medical plans, and the premiums on these are they're really, really good. So for that 5,000 annual maximum plan, it's $96 a month. It's crazy. So a similar plan with EMI or Dental Select is going to run you about $140, and it's probably going to have a $2,000 annual max, and that's about as high as they go. So great benefits, great price, good company. We've been using them for a couple years now. It's been working out very well. And with that, David and I will bid you all adieu. Thank you for listening to our watered down version of our education day. We spent about 2.5 hours at each one. So thank you. Thank you very much for joining us. Please give us a call if you have any questions. You can always call, text, email the Green Line at 801-889-1997. Thanks.
Okay. Thank you all.